To explain the low fidelity prototype of an automatic drug delivery system, and this automatic drug delivery system is the insulin drug delivery system. So we have this cardboard, which is regarded as the casing of the microcontroller, the circuit board, and also the stepper motor in the whole system. And we have the LCD, which will be on the casing, and also we have the reservoir, which is supposed to be inside in the high fidelity prototype, but for showcasing case, we have placed the reservoir on the outside. And also we have the IV tube, which will be used for the delivery of insulin, and the needle, which is going to be placed on the body of the user. So when the user wants to use this automatic drug delivery system device, first thing, he has to have a glucose meter separately, and the user will only need to have the glucose meter because after opening this device, the user has to enter the amount of glucose that he has measured at that particular moment, and also the time duration that he wants the drug delivery system to provide insulin to the body. On the time duration, it is set in the range of 24 to 72 hours, and in a range of 6 hours, like you can say 24 hours, 30 hours, 36 hours, 48 hours, in that range. And then after the user has entered the amount of glucose in their body and the time that they want the glucose to be given to their body, the microcontroller will modulate using the amount of glucose in the body. It will modulate the amount of insulin that the user needs at that particular moment, and it will divide the amount of insulin in the amount of time intervals that it is there in the time limit that the user has said. So after the user has said, the counters and will start the time delays and the counting in the microcontroller. And when 6 hours has elapsed, the microcontroller will beep an alarm to inform the user that it is the time, just to inform the user that it is the time for the dosage to be given. And after that, the stepper motor, the microcontroller will send a signal to the stepper motor to push the insulin in the pump. So the thing is, after the user has said the amount of glucose, the microcontroller will send the signals to the motor depending on the distance that it should push from the reservoir. That means if the amount of glucose in the body is high, the motor will step in a lot of distance. That means a lot of centimeters, which is going to be a lot of volume of insulin that will be delivered to the body. And if the amount of glucose was a little bit low, that means even the insulin that is going to be delivered is going to be low, depending on the distance that the stepper motor has pushed on the syringe. So after the drug has been delivered, after that range of duration, the counter, it will start recounting again another set of 6 hours. That means the drug will be given 4 times a day in a duration of 6 hours after 6 hours. And after that time that the user has said, the microcontroller will beep an alarm to inform the user to enter other new values into the system. Or even if the user wants to reset the information before the time that he says has elapsed, he can reset using a button on the LCD. That means he will also enter the amount of glucose at that time, and also another new duration of that time. That means the microcontroller and the system will start recording again, and it will start delivering the drug at the new set of the new set of diaries that have been inserted. So as you have already seen that this casing is very small and it's very portable. Someone can carry this thing, someone can carry it wherever they go in their pockets, just to make sure that this part of the system should be on their bodies, directly on their body, properly set on their bodies. So it is very portable, it is very durable, and it does not use very expensive way of measuring glucose in their bodies. That means they can just carry the glucose meter, which is a little bit affordable comparing to the other systems that they are used to measure the glucose in the bodies. And also it can even be used in the hospitals by nurses who have very tight schedules. It can be used by people who are very busy everywhere where they are going, or everywhere they are going, at work, at home. Yeah, it can also be said by guardians at home who are having diabetic patients. So we are sure that this kind of prototype, this kind of system is going to be of benefit to many users in the healthy sector of Malawi. Thank you very much.